It's amazing that you've squeezed so much wrong into such a short video. That was a comment I got on one of my videos online. I'm an ER physician and I'm responding to your questions and comments. I'll be sharing actionable steps that you can take to transform health systems. And the last question that I answer kind of caught me off guard. It's interesting. Question 1. What do doctors do when they are sick? You'd think we'd have a fast track to the best doctors in the community and we'd know exactly who to go to, but it's not that simple. We, of course, can ask our friends and nurses and others, but to be honest with you, there isn't, that I'm aware of, an easy way to know a doctor that has outstanding skills and knowledge and a doctor that doesn't have such outstanding skills and knowledge. So in many ways, we do what you do. We shop around, we ask around, we go to doctors that are within network, and we do the best we can. That was question number 1. Question number 2, thoughts on integrating wisdom from other health systems around the world to Western wisdom as part of transformation, like TCM. TCM I had to look up. I think it's transitional care medicine. Great question. And obviously we could spend a lot of time on this. This isn't something I'm necessarily an expert on, although early in my career I was focused quite a bit on global health. I did pull up an article that I'll provide a link to that is titled Models for Long-Term Care Policy, What the U.S. Can Learn from Other Countries. And there is much that we can learn from other countries. I'm just going to read a little bit about Denmark here. It says, no new nursing homes have been established since 1987 because of an integrated home care system. The Home Prevention Act mandates twice a year home visits to assess the needs of elderly citizens. This policy has resulted in a leveling off of long-term care expenditure and a drop in the percentage of GDP devoted to long-term care. So there's certainly much we can learn from other countries about reaching out to the community, visiting patients in their homes, and many other aspects of health and healthcare. But I caution against taking a recipe from a different, or a blueprint from a different country and transplanting it to our country. I don't think it'll work. Health systems are complex, adaptive systems. They're dependent on culture and history and politics. And so we can learn, but we need to allow ideas to emerge when incentives are aligned and when there's a shared vision of what we really want. So that was question number 2. Question number 3. It's amazing that you've squeezed so much wrong into such a short video. I really appreciate this, this comment. It was directed towards a few recommendations I had. One was that all pre-med students be required to major in health systems transformation. Another requirement is, or another recommendation that I had, is that there be competency-based, personalized, progressive board certification and diplomas and licensing for medical professionals, so that, say, a nurse practitioner with 20 years of oncology experience could become an oncologist with maybe 1, 2, 3, 4 years of training instead of the current 11 or 12 or whatever it is years. I've also recommended that physicians and other healthcare leaders, administrators, health professors, public health professionals, so everyone in a community that is working towards health be paid at least partially based on either the level or the improvement of the health of the population, as well as the equity and the efficiency. So we base the payment and other incentives on what we really want as a society. And I've made a number of other recommendations ranging from universal basic health insurance, etc. So I'm not necessarily married or tied to these specific ideas. What I'm trying to do is take a bird's eye view and think, okay, if our health system wasn't so driven by profits, if it wasn't so driven by acute, episodic rescue care like the type I provide in the emergency department, if it wasn't so driven by elitism on many levels, then what would our health system look like? And how can we make the transition into a health system that's driven by health, equity, and efficiency? So that was question number 3. Question number 4. You got to lose those plaid shirts. Okay, thanks for the feedback. 5, I guess. Thoughts on providers needing to deal with insurance, how it impacts patient care. So as an emergency doctor, and I'm paid kind of on a salary or hourly, as opposed to dealing a lot with insurance billing. So to be honest with you, I don't deal with insurance hardly at all. But I'm certainly hearing from my colleagues and online the burden that comes with prior authorization, insurance, et cetera. I'm going to provide a link that I found that talks about low reimbursement rates for providers, requiring prior authorization for specific treatments and excluding some services from coverage, stringent utilization reviews, and excessive claims denial processes. It goes on and on and on here, enforcing narrow provider networks that restrict patient choice. Delays in patient care because of administrative policies of insurance companies. So it affects patient care in many ways, although that's not something I can speak to directly on an individual level, but I'm happy to look into that more if there's interest along those lines. So that was number 5. Number 6. Question number 6. So what about those Carolina doctors from the 1800s? So for the last 8 years, I've dedicated a lot of my time doing primary research to write a book about 2 physicians that lived in 1890s Raleigh, North Carolina. One was a Black physician who was bold and visionary and brilliant and had this vision of improved health for his people. And he did an extraordinary number of things, from founding a new medical society to teaching public health to being heavily involved in politics to writing a book about celebrated Black women. So he was attacking this idea of improving the health and well-being of Black people from a number of different angles. And finally, he connected with a nurse named Marie Burgess. They did home visits. They worked on prevention and relationships, and the deaths plummeted. The other physician, named Hubert Royster, was absolutely brilliant, a pioneering surgeon, but also a white supremacist. And I won't kind of give away how the story ends, but it's both inspiring and wonderful and also tragic. So that was number 6, I guess. Number 7, the food industry has to change too. Absolutely. So we are plagued with metabolic syndrome, which is something I'm just learning more about over the last year or so, but it has to do with insulin resistance. It's tied to polycystic ovarian syndrome and perhaps dementia and obesity and diabetes, of course. And the food that we eat, so high in hyper processed foods, ultra processed foods, and high in carbohydrates, is thought, and there's increasing evidence, and I'm convinced that it's a major factor to our poor health. And so is our food industry playing a major factor? I certainly think it is. And we as consumers can choose different foods and companies, and there's also a role for regulation, I believe, in legislation. That was number 7. Okay, number 8, I guess. What are some actionable steps an average person can do to do something today to transform the healthcare system? Man, I wish I could tell you one specific thing that would transform the health system. Let me just preface answering this question by saying that as I learn about how complex systems like health function, and as I learn about successful social movements of the past, I'm convinced that it is somewhat unpredictable. So and also that things happen through phase shifts or paradigm shifts. So we're in one state and everybody gets comfortable and the status quo is invested in that state. And then there's a critical mass of people and organizations and ideas that elevates to challenge that status quo. And then for some reason, sometimes unexpectedly, sometimes surprisingly, sometimes gradually, there is a shift to a different state or phase or paradigm. So I could tell you to advocate more for the marginalized, or provide direct feedback to your doctor, or volunteer in your community to improve the health of homeless people, or to not pay initially your bills. So there's and you could think of many more, and there are dozens, hundreds of other ways to move to improve the current episode of care or needs of people, and all those things can and should be done and are being done in so many ways in so many communities. But that won't, in and of itself, I don't believe, necessarily result in transformational change. It might, but I think it's less likely to. And that's because all of those activities